Tony Blair, you mentioned, who did put a lot of money into the health service, massively increased the pay of doctors, GPs in particular. But how is Keir Starmer going to deal with the population explosion? You know, we have now a population that has risen by 8 million since 2001. We've got these extraordinary figures coming on Thursday. We're told next year will be the same, and no evidence that Labour will reduce them. How on earth do you provide healthcare with the existing NHS, given the time leads of building new GP surgeries and hospitals? How on earth can ordinary folk expect reasonable access to a health service with a population that's going through the roof?
Well, I think this is a really good question, and there are two, I think, answers to that. The first is, of course, that if you've got 8 million more people, you've actually potentially got 8 million more people paying tax in this country. And that in turn means that we've got more money to fund our services, quite apart from any tax exemptions on things like non-DOMs, by which we will bring in more than 3 billion a year by removing that ridiculous anomaly in the tax system enjoyed by a very small privileged few. But the other part of this, which is something that Keir talks a lot about, and I'm sure it's something, Nigel, that you actually probably would agree on, is that actually this mustn't be a zero-sum game. What the UK has got to get back to is talking about how we're actually going to grow the economy. Where are the engines of growth going to be in the UK, taking advantage of Brexit in the future? Now, these are, again, issues which I think if we look at the Conservative Party, sadly, they've squandered in the last few years. Because what they've been trying doing is to squeeze more and more money out of the lemon. What they've not actually tried to do is to see how you actually grow more lemons in the garden. I think one of the crucial things about Keir's ambition for Britain is that it's also fueled by an ambition to grow the economy, not diminish the economy. And 8 million more people can take part in that economy and pay taxes to help fund public services.
Sadly, so many of the increase in people coming into Britain in the last year, so many of them actually are non-productive, which is deeply, deeply worrying. But I repeat the question. How on earth can you plan for future healthcare if you don't have a number, a target, a limit on the numbers coming into the country?
Well, I know you want to talk about migration till the cows come home. It's a very tempting
numbers and health, that's all.
No, but the answer is if people are coming into this country and they are working, then they pay taxes. And the most important thing to realise here is that we've got to get an NHS, whether it's about those 8 million or the rest of the country, as you are defining it. This United Kingdom needs a health service that's fit for purpose. And a health service, for example, that leaves 7.5 million people waiting for treatment. A health service that currently has nearly 500,000 people waiting more than 1 year for a treatment that should have been a maximum of 18 weeks.
I agree with all
300 unnecessary deaths every week with people waiting for emergency care. And suicide rates on the increase, with it now being the biggest killer of young people in the country. Now, to have a Prime Minister, to have Keir Starmer, hopefully, in Downing Street thinking that addressing these very important targets and problems is actually the point of being...
Well, I tell you what, Shaun Woodward, I tell you what, if he's able to do something to stop suicide, that would itself be a great miracle.